Hello everyone. In this video, we'll be focusing and discussing on the topic diagnostic methods in endodontics. These are the contents that are to be covered under today's topic. Coming to the introduction. Diagnosis is an art and science of identifying the disease by using scientific knowledge to determine the cause of the disease. Diagnosis plays a very important role in formulating correct treatment plan for any disease process. There are several methods used by the clinician for the diagnosis of dental disease, but the most common method is the conventional method, which includes visual, tactile, and radiographic examinations. Although the above-mentioned methods serve as an important diagnostic aids for diagnosis, but they also have some limitations. To overcome these shortcomings, there have been many recent diagnostic aids that have been introduced, which helps in detection of diseases in its initial stage. So, these are the commonly used diagnostic methods in endodontics. That is, the visual and tactile inspection of both the hard tissues and the soft tissues. The percussion, palpation, mobility and depressibility, bite test, magnification, radiography, which includes intraoral periapical radiographs and cone beam computed tomography or CBCT, and the assessment of pulp vitality, that is either through neural sensibility test or pulp vascularity test. Moving on to the visual and tactile inspection. This is the most simplest clinical test and it's done mainly during the examination, which includes checking the three C's, that is the color, contour and consistency. The clinician uses his eyes, fingers and explorer and the periodontal probe for visual and tactile inspection. Loss of translucency, slight color changes and cracks may not be apparent in poor light. In fact, a trans illuminator may aid in detecting enamel cracks or crown fractures. Percussion. This test enables one to evaluate the status of the periodontium surrounding a tooth. The tooth is struck acute, moderate blow, initially with low intensity by the finger and then with increasing intensity by using the handle of an instrument to determine whether the tooth is tender. The percussion test includes two types, that is the vertical percussion test and the horizontal percussion test. A posterior vertical percussion test indicates a periapical pathology, whereas a posterior horizontal percussion test indicates a periodontium related pathology. Palpation. This simple test is done with the fingertips using light pressure to examine tissue consistency and pain response. Its value lies in locating the swelling over an involved tooth and determining the following features: whether the tissue is fluctuant and enlarged sufficiently for incision and drainage, presence, intensity and location of the pain, presence and location of adenopathy, and the presence of bone crepitus. Mobility depressibility testing. The mobility test is used to evaluate the integrity of the attachment apparatus surrounding the tooth. The test consists of moving a tooth laterally in its socket by using the fingers or preferably the handles of two operating instruments. The test for depressibility consists of moving a tooth vertically in its socket. This test may be done with the fingers or with an instrument. Miller's Tooth Mobility Index. First degree mobility. It's a first distinguishable sign of movement greater than normal. Second degree mobility. Horizontal tooth movement with a range of 1 millimeter. Third degree mobility. It's a horizontal tooth movement greater than 1 millimeter or when the tooth can be depressed. Bite test. The bite test is useful in identifying a cracked tooth or fractured cusp when the pressure is applied in a certain direction to one cusp or section of the tooth. Tooth sleuth and the frag finder are the popular commercially available devices for the bite test. The clinician should note whether the discomfort or pain occurs during the act of biting or during the release of bite force. Pain on biting indicates symptomatic apical periodontitis. Pain on release of biting forces indicates a cracked tooth. Magnification. It is an essential requisite in current precision-based endodontic practice. Application in endodontics include locating hidden canals obstructed by calcification, detection of cracks and fractures. Radiography. The radiograph is one of the most important clinical tools in making a diagnosis. It permits visual examination of the oral structures that would otherwise be unseen by naked eye. Intraoral periapical radiographs. Periapical views are used to record the crowns, roots, and surrounding bone. Bite-wing radiographs. Bite-wing or interproximal views are used to record the coronal portion of maxillary and mandibular teeth in one image. They are useful in detecting interproximal caries and evaluating the height of alveolar bone. Advantages of using bite-wing radiographs are as follows. Interproximal caries in early stage of development reveal secondary caries below restorations. Evaluating the periodontal conditions, especially effective and useful for detecting calculus deposits and interproximal areas. Coming to the digital radiography. Digital radiography is a method of reproducing a radiographic image using a technology sensor of solid state which are broken into electronic pieces and presented and stored as an image using a computer. A digital image is a collection of brighter and darker areas same as that of a film-based image, but the nature of the digital image is totally different from that of the film. Direct digital images and semi-direct digital images. Direct digital images are acquired using a solid-state sensor. The solid-state sensors are based on charged coupled device or CCD and complementary metal oxide semiconductors or CMOS and CMOS active pixel sensor, that is CMOS APS based chips. Semi-direct digital imagings are obtained using a phosphor plate system. Cone beam computer tomography. Cone beam computer tomography is recent technology initially developed for angiography in 1982 and subsequently applied to maxillofacial imaging. The device utilizes a cone-shaped beam of ionizing radiation which passes through the center of the region of interest. An X-ray detector attached to a rotating gantry captures the radiation on the opposite side. The resultant information is then generated digitally through a series of multiple planar projection images of the field of view. The image is captured as three-dimensional pixels termed as voxels with a resolution ranging from 0.4 to 0.076 millimeter. It is helpful in detection of vertical root fractures, helpful in detection of root morphology, the number of roots, accessory canals, and to detect the separated instrument endocanal. It is helpful in endodontic surgery planning and identification of root canal, which is not seen in 2D images. The pulp vitality test. Pulp vitality test plays an important role in diagnosis of the status of the pulp. Pulp tests are usually done before restorative or endodontic treatment to aid in treatment plan. Pulp that is vital is indicated for restorative treatment. Pulp that is non-vital is indicated for endodontic treatment. This is indirectly done by assessing the neural sensitivity of the pulp. Methods for tooth vitality assessment. It includes two tests, that is a neural sensibility test, which includes the thermal test, heat test and the cold test, and the electric pulse test, the anesthetic test and the test cavity. The pulse vascularity test, which includes two types, that is the pulse oximetry and the laser Doppler flowmetry. Moving on to the neural sensibility test. These are the tests that indirectly tell us about the vitality status of the pulp. They work on the principle of stimulating the neural fibers present in the pulp. Thermal test. These tests involve the application of cold and heat to a tooth to determine its sensitivity to thermal changes. The results of the thermal test should be correlated with the results of other tests to ensure validity. Heat test. The materials used for heat test includes electrical heat carrier, hot gutta-percha stick, and others include hot water under rubber dam isolation, hot varnisher, hot compound, and dry rubber polishing wheel. Heat tests can be performed using different techniques that deliver different degrees of temperatures. Procedure. The area to be tested is isolated and dry and a suitable lubricant is applied. The heat is directed to the exposed surface of the tooth and the patient's response is noted. A heat carrier instrument that can deliver a controlled temperature to the tooth is preferable, or a hot gutta-percha stick can be employed. When using a solid substance such as hot gutta-percha, the heat is applied to the occlusal or the buccal third of the exposed crown. If there is no response, the whole substance can be moved to the central portion of the crown or closer to the tooth cervical margin, and when the response is felt, heat should be removed immediately. Cold test. The materials used for the cold test include endo ice, that is 1112 tetrafluoroethene, carbon dioxide snow, pencil of ice, ice cold water under rubber dam isolation, and ethyl chloride. Procedure. The most common method is to apply a cotton pellet saturated with 1112 tetrafluoroethane to the tooth being tested. Another simpler method of applying coal to a tooth is by following these steps. Wrap a sliver of ice in wet gauze, place it against the facial surface of the tooth, and compare the reaction to our control tooth. Pencils of ice can be made by filling discarded anesthetic capsules with water and freezing them in an upright position in a refrigerator. The rubber stopper should be at the base of the capsule to enable one to force the ice out of the capsule and thereby obtain a pencil of ice. Electric pulp testing. The electric pulp test is one of the tests used to determine pulp vitality. The electric pulp tester, when testing for pulp vitality, uses nerve stimulation. The objective is to stimulate a pulpal response by subjecting the tooth to an increasing degree of electric current. A posterior response is an indication of vitality and helps in determining the normality or abnormality of the pulp. No response to the electrical stimulus can be an indication of pulp necrosis. Procedure. Describe the test to the patient in a way that will reduce anxiety and will eliminate a biased response. Isolate the area of control tooth and the tooth to be tested with cotton rolls and a saliva ejector and air dry all the teeth. Check the electric pulp tester for function and determine the current that is passing through the electrode. The test is always performed on a control tooth prior to the testing the tooth in question. Apply the electrolyte on the tooth electrode and place it against the dried enamel of the crown's occlusobuccal or incisolabial surface. It is important to avoid contacting any restorations in the tooth or the adjacent gingival tissue with the electrolyte or the electrode. This would cause a false and misleading response. Location of the probe tip. The placement of the tester is critical to ensure accurate response from the tooth. For the anterior teeth, the probe tooth should be placed in the incisional third. For the posterior teeth, it should be placed in mid-third of the mesiobuccal cusp of molars and buccal cusp of premolars. Completion of the circuit. Retract the patient's cheeks away from the tooth electrode and the electrical circuit is completed by either a ground wire is placed over the patient's lip in contact with the oral mucosa or the clinician instructs the patient to rest a finger on the metal sheath of the pulp tester. Turn the rheostat slowly to introduce minimal current into the tooth and increase the current slowly. Ask the patient to indicate when the sensation occurs by using such words as tingling or warmth. Record the result according to the numeric scale on the pulp tester. Repeat the foregoing for each tooth to be tested. The mechanism of action. The objective is to stimulate A delta nerves in the pulp ganglion complex by electric current. As the electric current passes, there will be an ionic shift in the dendrite fluid which causes local depolarization, which causes the generation of an action potential from intact A delta nerves, which induces a positive result. Clinical interpretation of pulpal response to electric pulp testing. Normal response. A positive response is a response that occurs at the same neural excitation threshold as the control tooth. The test tooth would be considered normal and the vital tooth and the teeth exhibit a positive response at a similar numerical value of the electric pulp tester. Negative response. This denotes a non-vital tooth which fails to respond even when the tester is set to the highest electrical excitation value. Early response. This denotes a diseased state of pulp as the tooth responds to a threshold which is less than that of the control tooth. Delayed response. This also denotes a diseased state of the pulp wherein the tooth responds at a significantly higher electrical excitation level compared to the control tooth. False positive response. When gangrenous necrotic pulp is present in a root canal, the multi-rooted teeth in which the pulp is partially necrotic with some nerve fibers still vital in one or more of the root canals. False negative responses. Calcification in the pulp tissue or dentin in a tooth with increased reparative dentin and a diminishing pulp cavity, fibrotic pulp, teeth with extensive restorations and a pulp protecting base. Recently traumatized teeth. Coming to the anesthetic test. This test is restricted to patients who are in pain at the time of the test when the usual tests have failed to identify the tooth. The objective is to anesthetize one tooth at a time until the pain disappears and is localized to a specific tooth. Technique. Using either infiltration or the intraligament injection, inject the most posterior tooth in the area suspected of being the cause of pain. If pain persists when the tooth has been fully anesthetized, anesthetize the next tooth mesial to it and continue to do so until the pain disappears. If the pain cannot be identified as from maxillary or mandibular origin, an inferior alveolar nerve block, that is the mandibular block, can be given. Cessation of pain naturally indicates involvement of a mandibular tooth. Test cavity. This test allows one to determine pulp vitality. It is performed when other methods of diagnosis have failed. The test cavity is made by drilling through the enamel dentin junction of an unanesthetized tube. The drilling should be done at a high speed and with a water coolant. Sensitivity or pain felt by the patient is an indication of pulp vitality. No endodontic treatment is indicated. Sedative cement is then placed in the cavity and the search for the source of pain continues. Pulp vascularity test. The most common methods to assess the pulp vitality are based on the sensitivity assessment of the neural tissues of the pulp. These include thermal and electric pulp tests. True vitality status can be ascertained only when we are able to access the vascular or blood supply to the tooth. Pulse oximetry. The term oximetry is defined as the determination of the percentage of oxygen saturation of the circulating arterial blood and readily differentiates between vital and non-vital state. A pulse oximeter works on the principle that uses a photoelectric diode that transmits light in two wavelengths. The effective and objective method to evaluate the pulse vitality. It is useful in cases of traumatic injuries where the blood supply remains intact but nerve supply is damaged. It is easy to reproduce the pulse tissues. Laser Doppler flowmetry. The laser Doppler flowmetry is a non-invasive electro-optical technique which allows a semi-quantitative recording of pulpal blood flow. LDF identified more vital and non-vital T correctly at earlier time periods following injury than conventional tests. But it is too expensive device for use in a dental office. Dual wavelength spectrophotometry. Dual wavelength spectrophotometry is a method independent of a pulsatile circulation. This method measures oxygenation changes in the capillary bed rather than in the supply vessels and hence does not depend on a pulsatile blood flow. Dual wavelength spectrophotometry was able to differentiate with reproducible readings between a pulp chamber of a vital and non-vital tooth in vivo. The instrument is small, portable, relatively inexpensive, and should be suitable for use in a private dental office and can be developed as a pulp tester. The test is non-invasive and yields objective results. Plethysmography. In this, analysis of optical properties of selected tissue is done. It was introduced as a modification of pulp oximetry by adding a light of shorter wavelength. Applied to the investigation of arterial diseases because the volume of lymph or oxygen exhibit transient cardiac change over cardiac cycles. Thank you.